Hey, it's Mo Egger. I tell you what, there's nothing better than sitting outside on a patio on a beautiful summer night. If you're looking for a spot with your buddies, Long Neck Sports Bar and Grill, 3 locations in Northern Kentucky, Wilder, Hebron, and Richwood. The menu is awesome. I'm a huge fan of Long Neck's wings. They've got an amazing beer selection and 4K TVs inside and out. Plus, remember, for football season, they've got the sound on for all the big games. Long Neck Sports Bar and Grill. Stay late, come often. 21 minutes after 3, this is ESPN 1530. I'm Mo Egger. We'll go to Bengals training camp in 20 minutes and chat with Tony Pike. Big news yesterday, or I guess among the big stories yesterday, Joey Votto's season is over. Rotator cuff surgery scheduled for tomorrow. Ideally back at the start of spring training in 2023. When I have questions about stuff like this, I go to the experts at OrthoCincy's, and Dr. Michael Greiwe is an expert when it comes to rotator cuffs, when it comes to the shoulder, when it comes to rotator cuff surgery. He's our go-to guy, and so I had questions. He has answers. Doctor, it's good to have you. How are you?
I'm doing great. Mo, how are you doing?
I'm doing wonderful. Answer this question for me first. So Joey Votto said he first suffered the injury in 2015. He's having the surgery 7 years later. How does that happen?
Yeah, that's a great question. I think he probably had a partial tear in that rotator cuff back in 2015, and it's likely progressed at this point 7 years later, and that usually is what happens with these partial tears. So I think that is likely to be the case. I don't think the training staff would have left a full-thickness tear go with Joey back in 2015.
I've had fatigue in my shoulder from throwing, right? I've done that. I went to fantasy camp once, and by the end of it, when I had hair, I couldn't lift my arm to shampoo my hair, right? And so yet Joey was still playing as recently as 2 days ago with an injury that's now going to require surgery. So if you're dealing with a torn rotator cuff, how hard is it to just simply do normal things, much less play Major League Baseball?
Yeah, I mean, this had been incredibly difficult. I'm sure with a torn, tendon there, he was going to have a lot of pain. And I believe he said, I had pain in 2015. It sort of subsided and got a lot worse recently. And clearly that's, why he's having to have the surgery at this point. Describe
for me the procedure and what's involved here.
Well, the surgeon's going to go in and they're going to reattach the torn tendon back to the bone, essentially. And that requires surgical anchors to be placed in the bone. And then the anchors have sutures attached to them. They'll pass those sutures through the tendon, tie the sutures, and then typically bring them over to a second row of suture anchors as well. So we call that a double row repair. That's likely what Joey's going to have done.
This might sound like a really dumb question, but that's what I do. What is the difference between, say, a rotator cuff tear and a shoulder separation?
So a shoulder separation involves something called the AC joint, the acromioclavicular joint. So that's a shoulder separation in sort of layman's terms. Typically, you tear ligaments to get that to happen. In this case, this is actually a tear of the muscle and tendon unit from the bone, which, we use to lift our arms. So the rotator cuff is specifically used to do that. And, to play Major League Baseball, you need to have a functioning rotator cuff, to be able to do that well and effectively without pain. So that is the difference, basically.
The procedure happens, and then there's recovery and rehab. Outline for me what's ahead in the coming months for Joey or for anybody else who would have this sort of procedure.
Well, the surgery happens day one, and I'm sure Joey's going to get into therapy almost immediately. He's going to have a sling probably for about 6 weeks. They'll be working on him at least for, 4 months, really just trying to get range of motion back, start the strengthening process as well with physical therapy. And usually by about 4 to 6 months, players and, lay people can start feeling better from that rotator cuff surgery, but it is pretty grueling. It is a difficult surgery to get through.
It seems like it. The specific surgery that he's having is not on his throwing shoulder. He throws with his right arm, right? This is on his left shoulder. So are there major differences in terms of the rehab and the recovery if it's on the arm you're going to be using to throw versus the arm that you're using to not throw?
Yeah, I mean, thank goodness this is in Joey's non-dominant arm from a throwing perspective because it's much more challenging to get back to throwing when you've got a cuff tear on that side. that you throw with. So I think we're all fortunate in Cincinnati that it's his non-dominant arm. That'll be very good, but it's a much, much more challenging and difficult rehab. And for many pitchers, rotator cuff repair is kind of the kiss of death. It's very difficult to recover from, very difficult to come back to be able to throw effectively. So I think we're all thankful for that.
When would a normal person like myself, if they were dealing with shoulder pain, right? And we talked about dislocated shoulders, and sometimes your shoulders just might go through the regular soreness that comes with living everyday life, especially as you, like I have, moved into my 40s. When do you know what, my shoulder pain is because of a rotator cuff, because of something similar to Joey Votto?
Yeah, and I think he has explained it a little bit in his interviews, but he's having weakness. And when you have weakness with your arm and you cannot lift it above your head, or you have difficulty lifting, and there's some weakness that happens, that is typically a rotator cuff until proven otherwise. And so if I've got somebody with those symptoms, they're getting an MRI right away.
Awesome stuff. This has been very helpful. Doc, I appreciate it, man. Thanks so much.
Thank you, Mo. Appreciate it. Have a great day.
You do the same. Dr. Mike Greiwe, he is with OrthoCincy's, which, by the way, locations all throughout greater Cincinnati, northern Kentucky, and southeast Indiana. For all of your orthopedic needs, they've got locations with Saturday hours, late night as well. Check out OrthoCincy.com. Those folks are the absolute best. I knew calling Dr. Greiwe would provide some answers, and he certainly brought them. 27 after 3. Hey, it's Mo Egger. If you and your buddies are looking for a place to hang out on a nice summer night, how about Long Neck Sports Bar and Grill? They've got 3 Northern Kentucky locations, Wilder, Hebron, and Richwood, all of them really easy to get to. An amazing menu. I love Long Neck's wings. You're not going to find a better beer selection anywhere, and they've got 4K TVs all over the place. And remember this for football season, they've got the sound on for all the big games. Long Neck Sports Bar and Grill. Stay late, come often.